Well, no doubt it's a challenge because 2020 is of course approaching quite fast now, and to think that we might have solved all the issues that we want to solve in the next 2 years is probably an uphill struggle. But I think it's always good to have a target and to make sure that you're heading in the right direction. So I think a lot of work's been done on diagnosis. I think there's a lot more to do on the support that people get once they've got their diagnosis, or indeed in the run-up to what might be a diagnosis. And I think that the resourcing challenge in the NHS and councils doesn't help, particularly with some of the earlier interventions that need to be made. But I think without the challenge, perhaps we would have made less progress. Well, I think we have to think about this in the context of where the whole health service is going, coming to NHS 70, actually social care is 70 as well. The National Assistance Act was around the same time. And we need to think about a system that's fit for the future, not the past. And so we were going to have more people with long-term conditions, people with dementia, unless treatments are found that are effective. And so we need to think about what can we do to help people live with the conditions they have. And we will need to invest more earlier in the process to prevent higher costs further down the line. It's not different with dementia than with other things, but I think one of the differences is it can be quite a long journey, or dementia journey, or I mean it can be quite short, but I think you need to have the right support available at the right time, and particularly to help carers and families to manage as people's disease progresses. Well, I think resourcing is a challenge, isn't it? And we work for the Local Government Association. We do a lot of lobbying to make sure there's sustainable funding, both for adult social care and wider council services, including public health, because that's what some of this is about. But I think that the work that is done in health and wellbeing boards, and potentially in sustainability and transformation partnerships, the STPs, which are being set up to look at the future shape of services, need to think about the sorts of things and the combinations we need in the future, so that we've got less silo management, because of course someone with dementia needs a full range of health treatments like anybody else, but also they need things earlier than eligibility would suggest in social care terms. So we need those kind of multidisciplinary teams with the right person at the right time. And there's some of that going on, but it's not the way we work, as it were, now. It's still pilots and small initiatives. And I think those kind of ways of working need to be the way we go. Well, it's critical. They're what it's all about, aren't they? So it's not appropriate to sit in a room and decide how people's lives should be and what they want. Let's ask them, let's engage them, let's use co-design, co-production, and then we will get the kind of things people want. Now, people are, generally speaking, reasonable. They know that sometimes there has to be compromise. Not everybody's reasonable, but on the whole, when you engage people, they can accept limitations, because they get a choice about, okay, given these limitations, how should we go about this? And there's some evidence chatting to people at the conference today about that. So unfortunately I wasn't able to stay for the whole conference, but I think the highlight is the level of engagement that you get from the audience generally, and the fact that you have got people with real lived experience there, they're carers who can tell really powerful stories and engage the professionals, and I think it's a really good mix. Shut up.